Hi, and you are watching On the Town with Tanya, and I'm your host. And we're back again this week. Today's guest is back with us again, and we got the correct conditions today. So bear with us. Thank you very much for coming back. Today we have us. Hello, how are you? So let me just introduce you. Today we have the Director of Public Health of Ministry in the Kogi State of Nigeria. Please welcome Dr. Francis Akpa. Hello, welcome.
Thank you very much.
Thank you for
the pronunciation is Akpa.
Akpa?
Akpa. The KPA is Pa.
Akpa.
Like the sound of a gun. Yes.
Sorry, my apologies. Thank you so much for correcting me too. I appreciate it. So last week we were talking to you about just the state of health of people in Kogi and Nigeria, just in general. And just making some comparisons to African American health, and if it's things like food or environment. So basically, a lot of my questions will be based around that. But first, what inspired you to get into the medical field was the first thing.
Okay, for me, it's kind of tricky. I actually started out when I finished the equivalent of your high school, that's what we call secondary school here. Mm-hmm. I had straight A's in math, physics, chemistry, biology, and mathematics, and additional math. Mm-hmm. So I told my father that I wanted to study aeronautics engineering. Mm-hmm. And he wanted to repair aircraft, so I didn't want to fly aircraft. Mm-hmm. So he now said, young man, I don't have the kind of money. And I told him the trainings are not available in Nigeria. Mm-hmm. So my father is from a middle level individual. Mm-hmm. Told me he didn't have the funds to send me out to the country. Now, why don't I consider medicine? So at the time of filling my entrance exam into university, mm-hmm. I decided to choose medicine. So it wasn't really my first choice, but eventually was the choice. Mm-hmm. So I got into medicine in 1987. I was barely 17 when I entered medical school.
Wow.
So I was surrounded up in 1993, but then there was the crisis that came from the annulment of the election in 1993. Mm-hmm. So I had to stay over till February 1994. So I graduated February, Valentine's Day, 1994.
Wow. And what is your specialty? I know epidemiology was one, but what is your specific?
Like I told you, I'm in the domain of public health. Mm-hmm. And public health encompasses a whole lot of study areas like epidemiology, statistics, demography, public health management.
Okay.
And then psychology.
Wow. So so I'll get right to it. What's the biggest health problem or issues facing right now, particularly in Africa or in Kogi? I know you also have flooding. So I know there's been a couple of elements that are kind of like making it even harder. But what are some of the basic issues even before the flooding that you'd like to see change?
And what really happened is that we are faced initially on the casual look, mm-hmm. you think that we have diseases that are communicable in nature, mm-hmm. such like tuberculosis, cholera, mm-hmm. and the likes. Mm-hmm. And then we have malaria as well.
Oh, right.
Now, malaria is very prevalent because of the weather condition, which is very suitable for the multiplication of the vector mosquito. Mm-hmm. And then we have some other diseases like feral transmitted disease, which is one of the neglected tropical diseases. Mm-hmm. That are prevalent among the small children population. Okay. But incidentally, over the years, because of the change in lifestyle and then increased economic fortunes of Nigerians, we're beginning to see some of the diseases that I've seen in the Western world, like diseases of affluence, mm-hmm. like what they call non-communicable diseases.
Right.
Non-communicable diseases of hypertension. We're seeing cases of hypertension. Young people at the age of 40, they are involved in a strenuous exercise, they slump and die. Mm. So So we're seeing cases like that, and people are reporting cases of diabetes and the like. So, in fact, when I was doing my postgraduate studies in Lagos, one of my professors asked me, why don't I look at the dual epidemic that we're facing? And I asked him, sir, what do you mean by a dual epidemic? He said, we have epidemic of communicable diseases and epidemic of non-communicable diseases. So it's a whole spectrum. And in my department right now, all we do is that we have a communicable disease desk and we have a non-communicable disease desk. And then with the support of the National Ministry of Health, we're currently conducting a survey to determine the exact prevalence of non-communicable diseases, such as diabetes and hypertension. We call it the STEP survey. We've already done, we've already ascertained the enumeration areas, and then the field survey is going to commence anytime from now. So, in summary, we have the full gamut of battling with the full gamut of illnesses, including those ones that have taken epidemic proportions. COVID-19, we had a couple of cases of COVID-19. We had a couple well, you know that we had the threatening case of Ebola in Nigeria.
Right.
So for us, we had to prepare our team to respond to the Ebola. In addition to that, we have another hemorrhagic disease, Lassa fever, because it is transmitted through rats. Some of our communities are close to big refuse dumps, and we've been having a problem with handling that because since it started in 1959, we have not been started in Borno State.
Right.
National body has not been able to figure out a vaccine for Lassa.
Okay.
And that is a big problem. You know, the Lassa fever, we still get an increase, a surge in the number of cases, especially during the dry season, where some of our farmers do slash and burn, and then the rats move from their colonies in forested areas into homes, and then the big rat, that is the multi-mammoth rat, goes into this neighborhood, and people get in contact with their food arrangements where they open their foods, and then you know our processing mechanisms processing methods where some foodstuffs are dried along the roadside. So we presume that those rats getting their excrements and urine get into those foods, and when people eventually consume them, they get infected with Lassa. But sadly, we have not been able to put our finger on the real sequelae that leads to disease, the real sequence of events that lead to the disease. So we're actually putting a word out to the world who can help us in providing a Lassa fever vaccine.
Okay.
For me, it's a topical issue. You see, every time during the dry season, we're actually going to the dry season around. The rains have stopped. So, well, they stopped leaving an aftermath of a flood. So later on, in the next month or two, we start experiencing increased cases of Lassa fever.
Okay. Wow.
So in addition to battling some of the communicable diseases, we battle some of the epidemics like Lassa fever and the COVID that came.
Right.
So that is exactly the kind of job I do. I try to provide some level of community awareness of all these things. And then from the State Ministry of Health, we're able to put out treatment centers for Lassa. And we had a major treatment center for COVID.
So because we're short on time, I have some questions from some people that actually live there. So I just wanted to ask, they were the same ones yesterday. What is the state doing to assist women who can't afford bills in the hospitals? And now I'm not sure if that's just general, or now with the floods, it's even extra stuff.
It is a bit tricky, but what we do is that I must tell you, because a lot of explanation is required. Now we have a program currently where the federal government with President Muhammadu Buhari has approved what they call 1% of consolidated. The consolidated fund is the total funds that come to the federation account. So 1% of it at the federal is set aside for primary healthcare services. And so those things are divided into the 36 plus 1 states, including the federal capital territory. So the Kogi State gets their own portion of that 1%. So in the last year or so, I think it started disbursement in 2018. What came to Kogi State is in excess of about 700 million. That's about $1 million.
Right.
And then we are expected to intervene in our sub-national level. Okay. When it comes to sub-national level, where we have other subdivisions, what we call local government. In those local governments, we're supposed to provide interventions in 239 partitions, what you call counties on that side. 239 partitions. And those 239 partitions will take 131 people. The total comes to a total of about 30,000 people. And then this fund is directed at only the vulnerable. And the vulnerable includes pregnant women and children under 5, and then people with disability. So the Kogi State government has provided counterpart funds to take care of another batch of 16,000. So in total, what we do is that Kogi State has put in a mechanism to handle pregnant women and the vulnerable. Up to a total of 45,000 have been taken care of under this basic healthcare provision fund. For me, it's an exciting program.
Right.
And we're looking at the possibility of this thing having some impact in our maternal health indices and the care of pregnant women.
I mean, it's exciting. I just think for 45,000, I know there's millions. So it just, especially the people in the rural areas, you know, has that been difficult reaching out to people in the rural areas?
Like I said, these subdivisions we have, they're in rural communities. You know, we have 239 primary healthcare centers. They are in the rural community. So 131 people within the vicinity, plus a few number, about another 100, which have been supported by with the aid from the federal government, we have another aid coming from the state government. So around that facility, we have about close to 500 people being taken care of. And those are the vulnerable. Including pregnant women.
And that's an important community. So one last question someone asked, what is the plan of the ministry to ensure healthcare facilities are maintained and secure from being vandalized? I can imagine probably with the floods and everything, and that there's probably a problem, an issue.
Well, being vandalized, well, as it is right now, we have conducted, by virtue of the fact that I'm the Director of Public Health, I'm the chairman of the Rapid Response Team for the flood. And as we speak right now, we have done an assessment of the 9 LGAs in my state that were impacted by the flood. And so we're taking the census of facilities that have been badly damaged, and those are partially damaged. And then we've identified those ones, and we're at the point of carrying out rehabilitation activities. We have the support of Medicine Sans Frontiers, WHO, Save the Children, AYGF. They're all supporting us in this effort. So we have done what they call partners mapping, and we're trying to allocate some tasks to them. We're just at the point, myself and the state epidemiologist are putting together the profile of activities and where we need support for. We just finished a couple of meetings with Doctors Without Borders. So we're going to go into in-depth conversation with the Honorable Commissioner, who has the full right to give a public pronouncement of any of these interventions.
And so
any feedback I give you is not authoritative unless you speak to the Honorable Commissioner of Health.
Gotcha. That makes sense. And so last question, because I know your time is the best, as I know you're busy. And thank you so much for being with us. What are the particular diseases faced in the state that requires international support? That'll be the last question.
Like I said, we need support. If you can help us in finding a solution to Lassa fever, I'll be happy. And if we can have some support in the control of non-communicable diseases like diabetes and hypertension.
All right. Thank you. And what can people do to prevent that? Is there any food diets that they can change? Maybe not so much vegetables or whatever. Is there anything they can do it that way?
No, for Lassa fever, what we do is that we've been struggling with our partner organizations or institutions like the Ministry of Environment to speak to it, our Ministry of Agriculture to see if they can improve the food processing habits of our people. So that they don't start lining up foodstuffs for purpose of drying in the open. And then some markets have huge refuse dumps beside them. So we want those refuse dumps evacuated by the Minister of Environment. We want the Minister of Agriculture to ensure that appropriate food technologies are deployed for the purpose of drying their food, instead of using the natural method of lying them on the tarred road. So where they will come in contact with the multi-mammal rats. So for the purpose of lots of people, we're doing a lot in that regard. And then we need to continue sensitization of our people. And even at this point, we'd like any organization also support us in establishing a podcast platform so that we can continue to provide information to our people through the social media platform. I appreciate the fact that it's one of the jobs you do. It might be one of the areas I personally want to support us with.
Thank you. I appreciate you, because I'm trying to make it a thing where we on this side hear news from people from literally from Africa or wherever we're at around the world, and have a world perspective instead of just a local perspective. So I appreciate you taking the time, because I can think about what's
Thank you, Tina.
But everybody's issues is important, and together we solve problems as human beings. So thank you very much, Doc.
Thank you very much, Tina.
I know you have to run, and I appreciate you. So I'll just talk to my viewers, and guys, if you have any questions, you can always ask me, and I can ask Dr. Akpa anytime. Okay, so I appreciate you.
Very much.
Thank you, Doc. I appreciate you. So I'm going to.
Thank you very much.
Okay, I'll just share a video.
All right, thank you.
All right, bye-bye.
All right. Bye.
I'm just sharing. Let's see, guys. I'm just sharing a video.
Of course, this cantonment Shakaba axis of the Patamusu, and we are here to see for ourselves the impact of the flood.
So that's what, unfortunately, what some parts of Nigeria, Kogi, and another part are dealing with, is the flooding like that. And I'm sure Kentucky and other places in the U.S. can now identify with what that's like, because that brings a host of other illnesses, I can imagine. So that's not good. Sorry, that's just an alarm warning me. And so, yeah, so that's it. I'm going to show you one more video. Let's see if I have it here, just so you can see that, sometimes we're blessed what we have and what's going on with us, because I just got lost that. Sometimes we're blessed and we never know what is going to be our situation, but whatever it is in our healthcare, take care of yourself, eat right, please stay away from fried foods, and try to eat as plant-based as possible, real food, real seeds if possible. And we thank Dr. Akpa for coming, and he is the director of public health and ministry in Kogi state of Nigeria, and we thank him for coming. And we thank our foreign correspondent, Stephen Ezekor. Thank you so much for that footage. You are the best. And hopefully one day we'll have you on soon. Right now, their town is working with lights. There's no lights after a certain time, and there's no electricity. So that's the issue with the Zoom. So I had to do this through Zoom, guys. And that's why. But I will be talking to you all soon, and we're going to go back to end the show. And I thank you guys for taking the time to come. To come on. Bye. Alrighty, guys, that's it for this week. I appreciate you.